This is Alicia Uribe. I am doing week 3 lab video, bone video, which is the appendicular skeleton. So to begin, I'm going to go over the pectoral girdles. So turning it over. So the pectoral girdle, the clavicle, is right here. This is the acromial end, and this is the sternal end. Okay, so right here is the choroidal process of the scapula. Then you have right here the glenoid cavity. Okay, then you turn it around, and right here is the spine. You have the acromion right here. Then you have the supraspinous fossa, the infraspinous fossa. Now we're going to be going over the arm. This is the humerus. At the very top is the head of the humerus. You have the outside of this is a greater tubercle. Then you have the deltoid right here, deltoid tuberosity. Then you come down to right here, the medial, right on this side, the medial epicondyle. Then you have the lateral epicondyle. Right here is a coronoid fossa, and what goes in here is the corner process of the ulna, which is here. Then you have the capitulum, which is right here, and this articulates with the head of the radius. Then you have the trochlea, and this right here, this articulates with the ulna in the forearm. Okay, so looking at the forearm, you have the ulna. Right here you have the olecrayon, which is right there. Then you have the coronoid process, which is right in the middle. Then you have the radius, which is right down here. You have the head of the radius. And right here you have the radial tuberosity. Okay, so looking at the bones of the hands, we are looking at the very bottom. So the very bottom would be the scaphoid, which is right there. The middle one right next to it is the lunate. Then you have the triquetral, which is right there. And the pisiform, which is this bone right here. Then looking at the second row, which is right here, that is the trapezium, the trapezoid, the capitate, and hamate. Then we're looking at the phalanges. This is the distal, the middle, and the proximal. The metacarpals are the very bottom ones. So looking at the pelvic girdle, you have right over here behind, you have the acetabulum. Then right here you have the pubic symphysis. Then you have the iliac crest, which is right up here. And then you have the anterior superior iliac spine, which is right here. You have the iliac fossa, which is all right here. You have the great sciatic notch. The greater sciatic notch is right in here. Then right here you have the ischial spine, and right here the ischial tuberosity. Now we will be moving on to the upper part of the leg. This would be the femur. Then right here you actually have the head of the femur. You then have the greater trochanter. And then down here you have the lesser trochanter. You look down at the very bottom. You have the abductor tubercle right here. Then you have the medial, which is down here, the medial epicondyle. You have the lateral epicondyle, which is on this side. And for the medial condyle and lateral condyle, you have the lateral condyle right here and the medial condyle right here. Then you have, this is the patella, which is the kneecap. So going down to this part, you have the lateral right here and right here. You have the lateral condyle. Then you have the medial condyle, one here and one here. Then you have the tibial tuberosity, which is right here, and on this one right here. Then you have the medial malleolus, which is right at the very bottom, right there. And for the last of the tibia, you have the tibiofibular joints, which is right in here, or right in here. And as far as the fibula, this is the fibula, and this one is the fibula as well. You're looking at the head of the fibula right here, and as well on this side. And the lateral malleolus is right here at the bottom. And same goes on this side. Okay, so right here you have the calcaneus right here. Then you have the talus. Talus is right here. Then you have the cuboid, which is right over here. Then you have the navicular. Then you have the medial, intermediate, and lateral. And these ones are the metatarsals, and these are the phalanges.